special education, I get this question all the time. It's grossly underfunded because of the federal mandates. I wish I had a quick solution. Medicaid. A Medicaid, 74 million Americans are on Medicaid right now. 74 million. So I think it should be the question. What is that? 25%? It's not quite 25%. Of Americans. Should 25% of Americans be getting free health care? So, I think this is what I hear though, is that I hear that health care costs are way too high.
No.
So I hear that, so what I hear is, so when try to give you an example. In this emergency room today, if 10 patients go in there, the 3 or 4 people with private pay insurance are basically paying the tote for everybody that goes in there. And that's one of the reasons that private insurance is so up. There are people that need the Medicaid, and let's protect it and save it for those that need it the most. But again, Medicaid has went up 50% in the last 5 years. We're going to soon be spending more on Medicaid than Medicare. We're approaching $1 trillion a year on Medicaid. I'm telling you folks, that's unsustainable.
But you can't take care of your future. You can't take care of your children or our future.
So half of our children are on Medicaid. And I think that's the first ones we should protect. We should protect widows, seniors, children, absolutely. Those are the ones that we should protect the most. But I think there's just a lot of people out there that we should help get an education and help them to get a job and get off of Medicaid. As well.
Aren't you getting a job and have 200,000
Some folks asked me about making America healthy again and what that looks like.
Oh,
it's really interesting group. 60% of Americans have a chronic disease. 60% of Americans have a chronic disease. 20% of our children are on a prescription drug. 40% of our children are pre-diabetic. America has a chronic disease problem. And we can keep making new medicines. We can put everybody on Ozempic. But at the end of the day, we're still going to have lower ages when people are getting Alzheimer's and cancers and the litany of things because America is not healthy. This is something I've been trying to work with for 40 years. As an obstetrician, having a diabetic clinic, seeing my diabetic clinic going from 2 patients a week to 12 patients a week in my years of practice. It's quite a challenge. And I saw women make the lifestyle changes they needed when they had a baby inside of them. But it's really hard to change lifestyles.
But shutting down the hospital in Great Bend isn't good either.
So the big challenge with making America healthy again is the re-education and the reprioritizing. 70% of the calories we eat are from packaged foods. 70% of the calories we eat are from packaged foods, ultra processed. If you would. So do you want to have your own town hall? You can go outside and do it. You've interrupted me about 12 times. You've interrupted me about 12 times. I'm not being rude. I'm just asking you. Excuse me.
Tell us about measles.
Okay, let me finish this one. I'm happy to talk about measles as well. But if you want to drive the healthcare costs down, if you want to save Medicare, if you want to make Medicaid that's more feasible, not increasing it by 50%, we do need to make America healthy again. And I don't know why anyone would be against that. I really don't.
Yeah, go on.
Why did you let RFK go through?
Exactly.
Yes.
He's going to decimate the healthcare system.
Okay, so I'm a big fan of Make America Healthy Again. I'm going to keep fighting for it. It's going to be a challenge, and there's no promises. But if you want me to save Medicare, Medicaid, bring the cost of your health insurance down, then we do need to make America healthy again. Measles, goodness, I saw 155 people with it recently, is what I saw was the number. One young child died.
9 states.
Okay, and I spoke to the Biden administration about this 4 years ago. But if you have an open border, if you have an open border, so you all have your facts, but I'm just encouraging you maybe to listen to my facts for a second.
Can you tell us what a fact is?
I'm sort of giving you the facts as I see them. as your United States Senator, as a physician dedicated to the health of Kansans as well.
As our civil servants, you work for us.
So what I saw, I was elected by the people of Kansas by an overwhelming majority.
But you represent us all.
I do my best.
Your money comes from
You
Florida.
represent us all.
I do my best.
Whether you do your
don't even
best or
live
not,
here.
you represent every single one of us here.
That's
Of
right.
course I do.
Live here.
We want to convey that to you.
I appreciate that. How many people are even willing to come up and do this, right? Think about that for a second.
I applaud you.
We'll welcome you
I
in
welcome
Wichita if you wanna come to Wichita.
Yep.
Yep, we
Come
love
to
you, number
Population
part.
center of Kansas.
So measles. So back to measles. What I saw when I went to one of my 3 visits to the border was I visited one of the clinics there. It was full of people with communicable diseases. I said then we'll have a tuberculosis outbreak. I'm much more worried about the tuberculosis outbreak in Overland Park, in Johnson County, Wyandotte County. It's probably mostly in Wyandotte County right now. Then the measles. I encourage everybody to get their vaccines because the herd immunity is not going to work when there's 20 million illegal aliens in our country.
Stop. Don't blame it on
Listen.
us.
Just exemptions.
It's the Mennonites, it's the US citizens that are doing
So
it.
are you aware that many countries require vaccines and they'll actually hunt you down if you're not gotten the vaccine after birth? So
Okay.
probably those aren't a problem.
So there's a question about tax cuts and who benefits. Okay, so 2017-18, the Trump tax cuts happened. It saved Americans $1,000 a month. Saved Kansans $1,000 a month. Okay, so that is a fact you cannot dispute.
Did I
So
get
certainly those tax cuts saving Kansans $1,000 a month was very helpful. That was on average. So that was on average. Okay. So with those, this is one of the rudest audiences I've ever had.
You get what you deserve, just like your children.
You're not from Western Kansas. You're indeed.
Oh, I am. Oh, sir, I am. Yes, sir. Here.
Not children.
Okay, one.
Raise your hand. Western Kansas represent.
Hey,
I speak for just a minute.
Western Kansas.
Everybody off in this room, but that's my job.
Okay.
First of all, I want to thank you for coming out here. It takes a lot of guts, and thank you so much. I do appreciate that. And to do your job, I would have not wanted. I wouldn't have. I don't think anybody else in this room would really want it.
I want it.
I disagree.